Hello, everyone. Good evening, and thank you for joining Medical Channel Asia's online webinar. So we're called Dr. On Call, and I'm Marie, who will be your MC for tonight. Today's event is organized by Medical Channel Asia, and we're actually a one-stop solution for Asian health information. We've got lots of social media pages, so you can just go and check it out. We should be seeing some links in the chat box very soon. Before we go into the presentation proper, I just want to invite each of you to be part of our MCA journey by visiting our YouTube channel right now. You'll be able to find the link in the chat box, and once you're at the channel, you can click subscribe, and then you will be able to have access to hours of medical and healthcare content at your fingertips. So today, our very special guest and speaker is Dr. Leong Hoe Nam, who will be presenting about long COVID today. Dr. Leong is a senior consultant infectious disease specialist practicing at Mount Elizabeth Hospital, Singapore. He has a clinical interest in the treatment of complex infectious diseases, and he has had first-hand experience in managing outbreak situations, including SARS and H1N1 pandemic infections. He has also published several research papers on virology. So Dr. Leong has been frequently interviewed by live TV, radio presenters, and various print journalists. So you've definitely seen about him or heard about him in the news. He's frequently sought for an opinion on various infectious diseases. In fact, on Medical Channel Asia, we've also had the opportunity to get his input on the COVID variant Omicron in both video interviews and in our editorial articles. So we're very privileged to have him today to share his expertise with us and also to answer so many questions everyone has about long COVID. So Dr. Leong, please.
I'm going to share my slides here. There you go. Okay, we're going to talk a little bit about long COVID. It's honestly a curse to have long COVID. It is a curse because we know so little about it. There's really, honestly, very little treatment. And if you want me to jump to the end of the lecture now, that's the end of the story because we only know so little a bit about long COVID. But we're going to try to dissect through. We're going to go through as much information as possible so as to guide you along about long COVID. And as what we were talking about at the very beginning, we were asking who has COVID, who hasn't had COVID. And let's be honest, everyone is going to get COVID. You can't escape it. You can hide up in the air, you can hide in your own room, but eventually you will end up with having long COVID, having COVID eventually. But the question is, how bad are you going to be? Are you going to be just a mildly symptomatic case or no symptoms? Or are you going to end up with very bad COVID and then you could end up with even long COVID? Okay, let's go into what long COVID is all about, and I'm going to try to break it out for you. Now, everyone thinks that if I had cough with acute COVID and it keeps going on and on and on and on, it's actually long COVID. No, it isn't. If you want to break it up, the easiest way to try to understand it is to break it into three different sections of it. One is actually acute COVID. The other one is actually ongoing symptomatic COVID. And the last one is post-COVID syndrome. Acute COVID happens in the first 4 weeks where you actually have signs and symptoms. You just feel unwell. So someone asked in the question, I think it was Eileen. Eileen was asking, why do I have so much mucus with COVID? When do I clear it? How do I clear it? She's still going through the acute COVID at this point in time. That's not long COVID. So after the first 4 weeks, what happens is some people actually go on to symptomatic COVID that goes on for 4 to 12 weeks. It could be a symptom of that phlegm that continues to go on and it persists on and persists on, and we don't have a good diagnosis of it. But after 3 months or about 12 weeks, you end up with the post-COVID syndrome, which can be a variety of symptoms. And this can change between different people, and over time it can change a little bit as well. So acute, post-symptomatic, ongoing symptomatic, as well as post-COVID syndrome, three different spectrum of it. You need to kind of put yourself down into the right section based on the symptoms and the timing so that you can actually tackle it. So we already have had some questions coming up, and like for example, the mucus, that actually goes into the acute COVID section. We can talk a little bit about it. We can answer it live afterwards. There you go. So how do we actually define long COVID? I really like WHO's definition. It really tries to cover it. it's a bit lengthy. Go through with me. It says there's a history of a probable or confirmed COVID-19 infection. So this will be through an antigen test, will be a probable, or PCR test will be a confirmed COVID-19 infection. This happens 3 months after. We don't talk about symptoms now immediately with COVID or within 2 weeks or even 10 weeks, but we like to talk about it 3 months later. And then it will have last for at least 2 months. So you think about it, 3 months plus 2 months, that's altogether 5 months. And you have no other explanation for it. There's no alternative diagnosis. So this is where the doctor is a real idiot, because, and we'll sometimes call it idiopathic. The doctor is an idiot, the patient is pathetic, because we don't understand it. We don't have a good explanation. And that's how we call it end up long COVID. We don't have a good answer. We lump everything down together. So I like WHO's definition because they were very committed to saying 3 months. And after that, they went on to talk about the common symptoms, fatigue, shortness of breath, cognitive dysfunction. So these are very, very common symptoms in true long COVID. They feel very tired. They have a lot of effort. They try walking. Literally getting out of bed to go to the toilet is very, very exhausting for them. Their cognitive dysfunction, and the best description, or everyone likes to use the word brain fog. They can't seem to think. Things which they could do very quickly at the snap of the fingers, they can't. They just have a lot of hesitancy. What do you do in this scenario? Then they have to kind of think a little bit. They say, okay, this is what we have to do. When previously the answers have come out and fast like a machine gun. Now, CDC, which is the USA Center for Disease Control, came out with the definition. It means that while most people recover, some people have symptoms that will last on for weeks to months after recovery. And these people may or may not be hospitalized, and they have persistent or late symptoms. Now, I don't really like this definition because it's very woolly. It doesn't really try to define for you. It looks as if you still have symptoms after COVID. Okay, we'll call this long COVID. And CDC's definition is much shorter. They're actually looking for 1 month. But I would prefer WHO definition, which is actually 3 months. Now, this is NICE, which is the National Institute of Clinical Guidelines, where in UK, where they look into a definition of long COVID. They want to try to define long COVID well. When you define a problem well, you can actually label it correctly and study it correctly. So NICE actually put it as during after a continued infection from after 12 weeks, it's not explained by alternative diagnosis. I like it because it's very succinct. It covers the no alternative diagnosis after COVID infection, more than 12 weeks. And again, it talks a little bit about symptoms thereafter. And these are the signs of, these are the key points about it. 4 weeks, or more likely, more than 12 weeks. There's a typo here in the slide. 4 weeks or more likely 12 weeks, no alternative diagnosis. You get symptoms of fatigue, shortness of breath, and cognitive dysfunction or brain fog. You feel as if you run a marathon, and after that, you can't recover from the marathon altogether. Okay, just a reminder, there's a typo here. It's 4 weeks or more likely 12 weeks. There are multiple names of long COVID. You can call it long COVID, or you can call it the atas way, the scientific way perhaps. PASC, post-acute sequelae or SARS-CoV-2 infection. You also call them long haulers because you just keep going on and on and on. So I like the word long COVID because I think most people can understand the term very, very well. It's actually well shared out in the media, be it social media or the print media or the visual media. Long COVID, long haulers, PSC, this is fine. What's the cause of it? Do we understand it? The answer is no. We don't understand enough about COVID-19. Something that's very, very interesting comes out from a paper that's published in Nature just recently. They say there is a brain damage of sorts. And if you actually were to scan the brain now and scan the brain, say 4 months later or 6 months later, there are changes in the brain on the MRI. So there is a real problem. The trouble is that we cannot define it correctly. We don't know exactly where it happens. So all these are new information and we're still trying to understand it. So don't belittle the person who can't get out of bed after COVID-19. Okay, true. The person might be having a hangover and trying to blame it on long COVID, but let's be honest, there are many people who suffer from long COVID and they can't get themselves out of bed. They can't go back to a normal life. Nobody wants to spend their life lying in bed every day. And we have athletes who do easily 4 to 5 kilometers of running a day, but suddenly they can't even get themselves out of bed to the toilet. It's that bad. So it can be a mechanical issue, organ damage in the brain. We also know that you can damage some of the nerves inside. There's a long vagus nerve that comes from the brain that travels along the spine downwards. That controls the parasympathetic nerves, controls your bowel functions, etc. As well, even your breathing. So what happens in the vagus nerve is it gets damaged. And with that, a lot of your gut systems or parasympathetic nerves get damaged. There's also a report of peripheral nerves that are damaged because of COVID-19. So some nerve injury or brain injury is the cause for long COVID. But I think to just blame it on these two is too simple. Someone says that there are little micro clots. There are fibrin microclots. So the clots form up with amyloid and then they jam up at certain vessels, and in turn, you have poor perfusion of blood. Many of these patients will feel that they don't seem to be getting enough oxygen in. But if you measure the pulse oximetry, it's actually very normal. You do a sample of the blood is very normal. But the blood doesn't seem to go to where it's most needed. So are there little micro clots inside? Some people think there's a persistent of the virus somewhere. And because of that somewhere, it comes out and the body reacts against it. As it reacts against it, it forms antibodies. It's like the immune system is continually stimulated. When it's continually stimulated, you feel you're under threat and infection all the time. So that's a problem. One of the pathophysiology of it is that there's a recent paper that suggested long COVID is associated with type 2 diabetes mellitus. And then they seem to find that the genetic material of COVID-19 virus is in the blood. You may have actually the Epstein-Barr virus in the blood, and you may actually have antibodies, autoantibodies. That means antibodies that attack itself. You shoot a bullet off to an infection, but instead of hitting the virus alone, it hits other parts of the body, and these are called autoantibodies because you attack your own self. Okay, so the summary of causes, it could be a nerve tissue injury from the brain or nerves, it could be clots, it could be persistence of virus and risk factors. So you realize I put for 5, 6, 7, 8, I'm going to put etc., 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 because in the coming months, I'm very sure we'll find other association and causes for long COVID. Why? Why am I so sure? The answer is that I don't think a one simple answer or cause to long COVID will explain everything. I think it is a mixed bag of diagnosis. It's a mixed bag of various injuries because of the virus, and because it persists, it stays inside this long COVID. So there's actually a diverse cause, but ends up with a similar symptoms of brain fog, fatigue, breathlessness. It's not a one size that fits all, and it represents the different ways in which the virus attacks the body. At the end of it all, the mixed pot, which you cannot explain, becomes long COVID. Now, some of you may have come across the term called chronic fatigue syndrome or myalgic encephalomyelitis or ME. So I have had patients with ME, and I can tell you it is a curse to have ME. It's a curse to have ME because you can't go back to your normal life and normal routine. So it's really very, very frustrating. And there are many, many similarities between chronic fatigue syndrome as well as ME, as well as long COVID. So if we can solve the problem of long COVID, we might solve the problem of chronic fatigue syndrome as well. What are the symptoms of long COVID? You see two boxes here. I'm going to look at the ones in yellow because those are the more commonly reported symptoms. You can kind of figure them out yourselves because They tell you people who have little or no energy. Why? Because they have fatigue, shortness of breath, they have cough, they have sleep disturbances, they feel anxious and with depression, their cognitive impairment, and their difficulty concentrating, brain fog. Brain fog is pretty much very consistent across the board. Fatigue, brain fog, cognitive impairment, anxiety, and depression. Now, many people will deny saying depression. I think it is okay to say that, but I think it is very human to show depression if you can't get out of bed when 1 month earlier you could do the marathon. There's nothing depressive about that. Is there nothing embarrassing about that? People with long COVID, you have a problem. Let's deal with it. Okay, and the last and the most important thing we need is actually encouragement from each other. Now, there are other people who describe fever and pain. That's the box on your right. They can have chest pain and palpitations, their gastric symptoms, etc., musculoskeletal symptoms and dermatological symptoms, skin hair rashes and hair loss. Okay, by the way, if you have hair loss after 2 months, it is expected because after a severe illness, you do have long loss of hair, but thereafter it will come back. The term is called telogen effluvium. Telogen effluvium. For now, for example, I have dengue patients, but 6 weeks to 8 months, 6 weeks to 2 months later, they complain a lot of loss of hair. That's because the dengue fever was quite a bad episode for them. But that's not long COVID. That's very, very natural. Okay, now I'm going to go into a little bit of vague description of long COVID. It's called 2 clusters of symptoms. For some people with long COVID, they have a lot more of the tiredness ones. And these are the ones which I tend to see. Tiredness, muscle aches, difficulty sleeping, and shortness of breath. There's also a respiratory cluster. Those people who have more of the chest pain, chest tightness, and breathlessness. What's the significance of it all? What's the natural history? Does one do better than the other? I have no idea. But this is something which you want to monitor. There are people who are more tired. There are some people who have more respiratory symptoms. There's also children-wise. Children-wise, there are also 2 clusters. One subgroup is about 70% of them. One of them will actually start having less symptoms after 3 months. And the other one, the next class 2 ones, actually, they will have more symptoms of tiredness, headache, shortness of breath, and dizziness, and it goes on for 3 months. The people who are more likely to have do poorly, the class 2 with more prolonged symptoms, they tend to be female, older, and poorer physical baseline, as well as mental health baseline. At 3 months, they are more likely to have poorer physical and mental health. They have a lot more pain, discomfort, issues in mobility, self-care, and usual activities. So if you don't see them turning around at 3 months, then you're more into class 2. Again, what's the significance? We don't have a good answer for you now, but we like to try to separate and try to understand long COVID this way. So one of the things which the people are asking is, should we even get vaccinated at all? I mean, we are worried about COVID, but if we do get vaccinated with COVID, does it help? Do vaccines protect long COVID? But first, before we answer the question, we actually need to look at how prevalent long COVID is. So they use a symptom scoring, and overall they think that about 2% of the UK population has long COVID, and this is self-reported. So there may be a lot of bias to it, or if they will say, I feel very, I think I feel a little bit lousy. I'm going to say I have more symptoms than the other. So overall, we think that this paper actually says that there's about 2% of people who end up with long COVID. And this is more than 4 weeks after infection. What were the most common symptoms? Fatigue, loss of smell, shortness of breath, and difficulty concentrating. This is really the typical features of long COVID. So let's take it as about 2%. I know there are some papers which quote 10% to 40%, but I think those a lot of them aren't really long COVID, but the persistence of respiratory symptoms. How badly affected are they? 64% of them are affected by day-to-day activities. Some degree, 64%, 2/3. About 1/5 is actually has day activities which are severely limited. So 20% of them. So two-thirds will have symptoms of some degree of activities limitation, whereas 1/5 will have quite a lot of limitation. And what is affected? Fatigue is quite common at 51%, loss of smell 37%, shortness of breath at 36%, and difficulty concentrating at about 28%. And these are again self-reported cases. Who's at risk? Who is really at risk of long COVID? Unfortunately, the 35 to 69 years old. Yes, I do fall into that group. The females do get it as well, a little bit more common. If you live in areas which are more deprived with less support, then you're more likely to get long COVID as well. So if you work in the healthcare industry like myself, social care, teaching, education, you tend to get more long COVID. I think it tells you that there may be an emotional overlay element as well. If you have other activity limiting health condition or disability. If you have other disability, then it makes it even worse. Poor pre-pandemic health. That means before you fell sick, how good were you? If you're not of good health to begin with, it tends to suffer even more. If you're overweight or obese, it's going to end up worse, or if you have asthma, it's going to end up worse. What about long COVID in children? Those people with allergies, asthma, eczema, or other pre-medical conditions, you're going to be a little bit at higher risk for long COVID. Treatment. You realize that this kind of slide is kind of blank because we really don't have good ways of managing COVID-19. If you really want to try to manage COVID-19, first of all, try to read out as much as you can so as to support the person. Number two, be emphatic. So you need to let the people feel that you are listening ear to them and let them share. Let them voice it out, get it off their chest, they feel better. Number three, be encouraging. Go there and get the person going as much as possible. Now, you may see the person trying, but not really trying, and you get very exhausted. So it is very, very trying for the caregivers. But if you don't try to help your friend, then your friend may never step his fingers out. The people who do well for long COVID are those with endurance and persistence. So keep encouraging the person, be positive. Do I use medications? Yes, I do. I do use some drugs to help to change the mood, to actually positively encourage the individual through and through. Not that the medication changes the underlying problem, but it gives you a little bit of a warmth. It gives you a bit more encouragement to push on to the next step. At the end of the day, the patient comes to terms that I haven't lost COVID. I haven't lost long COVID. I still have it with me, but I've learned to control it. I've learned to put it aside from my life. And that's very much you can do for treatment at this point in time. There is something else which I can offer. I'm going to talk to you now, which is vaccination in long COVID. Does vaccination in long COVID help? So if I've been infected, I develop long COVID, should I go for vaccination? Will it make any difference? This is actually quite a long passage here. I'm going to summarize it for you here. They studied 900 individuals. 57.9% after the vaccination showed improvement. 70.9% worse, and the rest no change. So you have about 60% chance of getting better with long COVID after vaccination. I would. So it really tells you that the immune system is kind of in disarray, and when you do the vaccination, it kind of resets everything back to what it should be. And the improvement works better with mRNA compared to the AstraZeneca vaccine. So you go for a more potent vaccine, you might restart the immune system off better. So there is a dysfunction in the immune system, and you hope to reset it with a vaccine. Some people think it is because the remnants of the virus all around, and we do the booster shot, it actually resets it better. So yes, I will go for vaccination. Does long COVID can you prevent long COVID vaccinations? The answer yes. You do have this paper says that from the Israeli data, 54% less likely to have headaches, fatigue, and muscle ache. These are features of long COVID. You have less of this, and in turn, you have less of long COVID. Overall, this is good. This is not the only paper. They have other papers here which they didn't quantify exactly how much reduction. But in general, they're quoting about 50% reduction risk of long COVID. Now, this is where it becomes very controversial. So infection can cause long COVID. What about vaccines? Can vaccines cause long COVID? The answer is yes, because you are changing the immune response. But overall, the risk is extremely, extremely low. So when you do go with a long COVID risk of about 2% after infection, you're going down to less than 1 per 100,000, I suspect, or even lower for vaccines causing long COVID. So you're going from a relatively high risk to low risk of getting long COVID. Nothing is risk-free, but between getting 2% risk or very little risk, I'll take very little risk. In summary, long COVID is a rapidly changing field. In fact, the definition which I come across may change. Unfortunately, there's no blood test or physical test you can do to say the person is long COVID or not. There are many, many people suffering, but very few people actually understand or are understanding of the problem. Vaccinations do minimize the long COVID risks. And this is one of the reasons why we are still encouraging people to get vaccinations. And if you had long COVID, then it would make sense to try vaccination because you have a 57.9% of stepping out of it. And how I manage knowledgeable, listening ear, supporting, and just emphatic. Listen to the patient and encourage the patient on. And do not hesitate to use medication to try to prep and encourage the patient through and through and through. So I have a handful of long COVID patients with me, and I've also another handful of patients with chronic fatigue syndrome. Only through sheer will, determination, and supportive friends, colleagues, and even healthcare workers do they actually get out of it eventually. Okay, that comes to the end of my talk.